Acne vulgaris involves pilosebaceous glands. Most severe type of acne is acne conglobata. If a case scenario will be given where they mention a female with obsessive compulsive disorder is keeping on picking acne lesions over the face, then the diagnosis is acne excoriae. It's a type of acne. Acne rosacea features. In the question they will give you photosensitivity, blepharitis can be mentioned, flushing is also possibility. But remember the differentiating feature between acne vulgaris and acne rosacea is that acne rosacea does not have comedones. Okay, drug of choice for hormonal acne. In NEET, they might ask you directly like this, or they can even give you a case scenario where they will mention young female came with nodular cystic acne, or they can mention grade 4 acne, which is nodular cystic acne, and associated with increased central parting of the hair, which is suggestive of androgenetic alopecia. Or they can mention a young female with nodular cystic acne and irregular menses. Then the drug of choice is oral cyproterone acetate. As you all know, isotretinoin is a teratogenic agent, so 4 weeks of contraception even post treatment. That means after stoppage of the isotretinoin, the female should take some form of contraception for 1 more month. Till then, she should not conceive. Causative factor for acne are androgen, bacterial proliferation, hypercornification of the duct, hypersecretion of the sebum, follicular duct cornification, increased propionibacterium acnes, and insulin-like growth factor 1. But remember, it's not oily food which is causative factor for acne. As I mentioned already, androgen is a causative factor and its target is dermal papillae. Treatment of nodular cystic and recalcitrant form of acne over the face is isotretinoin. The maximum cumulative dose is 120 to 150 milligrams per kilogram body weight. Usually we advise isotretinoin for a minimum of 6 months. That means what I want to say is we will give it for 6 months, which is the duration for one course of isotretinoin usage in a patient with nodular cystic acne. Isotretinoin is very effective in acne because it is due to sebaceous gland overactivity. Isotretinoin can also be used in rosacea and it can increase the staph aureus colonization. And remember, isotretinoin is a hepatotoxic drug, so we should get liver function tests and lipid profile done prior to the initiation of the isotretinoin. It is not nephrotoxic, you remember this, because in the question they have given all except kind of question. Most common side effect of isotretinoin is cheilitis. It will cause dryness of the lips. If it is not there in the option, you can mark in general dryness. Minocycline is an oral medication used for acne. It can cause adverse effect of blue-black pigmentation of the nails. Remember, anthralin is not used in acne. 4D spots are ectopic sebaceous glands found in healthy people. They are not any sign of malignancy, or not. They are not present in axilla, and they are not erythematous. And 4D disease most commonly involves lips. If lips is not there in the option, then you can answer buccal mucosa. That is the next best option. For acne rosacea, they will give you case scenario mentioning a lady came with red macular lesion on central face, around the cheek and chin, associated with flushing on sun exposure, or even they can give with emotional disturbances and even with spicy food. They can also mention middle-aged man came with red papillopustules on convexities with background erythema and telangiectasias. Remember, the question should not mention any comedones, or there will not be any vesicles in rosacea. It's caused by Demodex follicularum and Helicobacter pylori. Drugs which can cause acneiform eruptions are phenytoin, isoniazid, and anabolic steroids as well. A variant rhinophyma, also called as potato nose, is because of sebaceous gland hypertrophy. Crystalline kind of miliaria is due to obstruction of the sweat ducts. Fox-Ford's disease is due to apocrine gland ducts obstruction, and it is commonly seen in adult women involving areola and axilla. Here you can find out that Fox-Ford's disease, all A's are there: apocrine gland involvement, adult woman, areola and axillary involvement. Hidradenitis suppurativa is also another condition where apocrine glands are involved. Here the most common site is axilla, followed by inguinal, perineal and inframammary areas. And depending upon the level of obstruction of eccrine glands, there are three conditions. Eccrine gland obstruction is called miliaria, but if it is at the level of stratum corneum, that is very superficial, then it's called crystallina. It's prickly heat. During summers we can see it very commonly. And if it is at the stratum spinosum level, then it's called as miliaria rubra. If it is at derma epidermal junction and upper layers of dermis, that is, it is a bit deep, then it is profunda. And if apocrine duct and follicle are obstructed, then it's called hidradenitis suppurativa. Then if there is another condition, syringomas. Here harmless eccrine sweat duct tumors, adenomas of the intraepidermal eccrine ducts are seen, usually involving islets. Bromhidrosis, here the defect is both apocrine and eccrine, but if in the options both are there, you prefer apocrine as the answer. Here there will be malodor. It is because of the Corynebacterium, which are the organisms staying in those areas like areola and axilla. And there are certain syndromes which are associated with acne: Sappho, Hiran, Saha and Papa. You should remember the full forms, and they might ask you all of these are involved in that means all of them are like pyogenic arthritis, pyoderma gangrenosum and acne. This constitutes Papa syndrome. They can give you some acanthosis nigricans in the options, and they can ask you all except are included in Papa syndrome, like that. In Saha syndrome, it is seborrhea, acne and androgenic alopecia. There might be a confusion in Saha and Sappho syndrome because both of them S is there, but remember it is synovitis, acne, pustulosis, hyperostosis and osteitis. Here in Sappho you can find that bones in joints. Here this is because of joints, and here it is bones. So you remember one thing, and you can automatically remember it is this S is not seborrhea but synovitis, and this acne and pustulosis you can remember together. So in this way you can differentiate if they try to confuse you. And Hiran syndrome, it consists of hyperandrogenism and insulin resistance and acanthosis nigricans. That's it friends in this video. If you liked the video, please do give it a thumbs up and share it with your friends in WhatsApp and Telegram groups, and please do subscribe to my channel. That's it friends. Thank you for watching.